All right, so for this module, I chose to do the infectious injury. These are either your gram-positive or negative microorganisms. This determines which antibiotics will work, or antivirals for the viral infections. These injuries can also produce diseases if they get too bad. Your most common ones are going to be your skin and your wounds. For the protocol for treatment, you're going to want to cleanse that wound as soon as you get the chance with the proper cleaning agencies upon your facility protocol for that. Depending on the stage of the wound will depend on what kind of medication you have, whether you do just the cleanse, whether you put topical ointment on, whether you would describe an antibiotic. It depends on what stage or how deep the wound is. You may even do a wound culture, and some wounds may need debridement, they may need wound vacs, that kind of stuff, The essentials for that. Also, if a patient has any underlying conditions such as diabetes, HIV and AIDS, malnutrition, or anything that will compromise the immune system, that could slow the healing process of those injuries. And then for the medical implications, like I said, if it's you may need antibiotics. If it's a viral infection, you might need antivirals, your topical ointments, your wound vacs, debridement. It all just depends strictly on how severe the injury is. Also, you're going to need to make sure that client is getting adequate nutrition, they're well hydrated, and adequate rest. If they are bedbound or wheelchair bound, you're going to make sure you reposition them at minimum every 2 hours, depending on how it is. And that client, they may need turned more, repositioned more. Make sure that their undergarments are dry, they're not sitting in moist conditions. All that kind of stuff. You're pretty much infectious injuries, your most common are going to be your skin and your wounds from what I found on my research. So, yep.